Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I've been a cardiologist for 40 years. The feature presentation is ACC 2017 Hypertension Guidelines. These are the guidelines for your blood pressure. When do we treat patients with high blood pressure? What is the goal for treating high blood pressure? What do we need to do to bring the blood pressure down? And more importantly, what you need to do to bring your blood pressure down, and we'll tell you as why you need to bring your blood pressure down. So let us continue with the feature presentation. Here is a beautiful flowchart showing how we need to manage patients with varying levels of blood pressure. If the systolic blood pressure is 120 and the diastolic blood pressure is 80 millimeters of mercury, that is a normal blood pressure. However, if you're beyond the age of 40 years and you have other associated symptoms, then you need to modify your lifestyle habits and then reassess your blood pressure and your overall condition in 1 year. When we talk about lifestyle modification, this is a lifelong modification of your lifestyle. This is the way of your new life as how you live in order to stay away from heart doctors and hospitals. Let us look at what are these lifestyle modifications that we have to follow no matter what the level of your blood pressure is. And we'll get to the other columns in a minute. So here are some of the things that I'm highlighting as far as the lifestyle habits that we need to adapt from this day onwards until the sunset. We need to keep our weight down. If you're overweight, that is the first thing you can do to bring your blood pressure down. The ideal body weight is supposed to be a BMI of 25. You can pull up a BMI chart by Googling your height and weight. The main thing is if your BMI is 30, you aim to get your BMI to 27, 26, and 25. You just go in successions and you don't do this over a weekend. That's not going to happen. If you're smoking, that's the number 2 risk factor for heart disease. When you combine that with hypertension, your risk exponentially goes up as far as heart disease and stroke and other complications are concerned. So you need to consider seriously smoking cessation and seek whatever help you can to keep your blood pressure down. If you are having high blood pressure, as we get to the next column, you need to keep your salt intake to around 2.4 grams or less per day. Next, if you're overweight, which most adult Americans fall in this category, at least 50 to 60% of them, then we need to restrict our calorie intake. Restricting carbohydrates and restricting calorie intake will do a great deal to you than most medications will to bring your blood pressure down or reduce your cardiovascular risks. So I would say, just take the amount of calories you need for survival. You don't need more than 1200 to 1400 calories unless you have diabetes and you are under the supervision of an endocrinologist or a dietitian. Then I think your calorie restriction should be to the minimum amount that your body requires. Exercise is another important thing to consider. 30 minutes of just walking 3 to 4 times a day. If you walk 10,000 steps a day, you have accomplished your goal of your exercise program. You don't need fancy machines. You don't need a membership in a gym or anything like that. Just go to grocery store, go to the park, go anywhere, mall, and start walking. You need to keep your cholesterol level down. Of course, when you reduce your carbohydrates, when you reduce your weight, all of these things will bring down your cholesterol level. You need to keep the LDL level below 100. And if you have diabetes, you need to aim for your hemoglobin A1C to be less than 7. So these are lifestyle changes which we have to adapt as our new life. Unless we do this, we are going to be facing problems. The next level is blood pressure, 120 to 129 over 80 millimeters of mercury. This is considered to be elevated blood pressure by the 2017 ACC AHA guidelines. Then You do not need any drug therapy, but you need drastic lifestyle modifications. Then reassess your blood pressure in 3 to 6 months. If your blood pressure is 130 to 139, over 80 to 89, you are in stage 1 hypertension, which increases your cardiovascular risk to about 10% over 10 years. You can try lifestyle modifications and recheck the blood pressure in 3 to 6 months. If the blood pressure is still high, then you need to be reassessed and we need to decide what is the goal for your blood pressure. The goal is to keep your blood pressure below 130 over 80 millimeters of mercury. And we need to reassess this, and if it is necessary, intensify your lifestyle habits, or you may need medications to bring your blood pressure down, which is going to be determined by your doctor. And reassess the blood pressure is doing okay, then you follow up and see what needs to be done. On the other hand, stage 2 hypertension is when your blood pressure is greater than 140 over 90 millimeters of mercury. That's when you need all these lifestyle modifications for good for the rest of your life. And in addition to that, you are going to need blood pressure lowering medications to reduce your blood pressure and bring the systolic and diastolic blood pressure to below 130 over 80 millimeters of mercury. Then you may ask the question, why do I need to bring my blood pressure down? I'm not having any symptoms. I don't feel bad. I feel great. I'm doing fine with whatever I'm doing. So why do I need these lifestyle changes? And why do I need to worry about my blood pressure when I have no symptoms? That may be well said and done, but here is the reason you need to be concerned about this silent killer, as it is called. Why it's called silent killer? Because hypertension, even though you have no symptoms, can increase your risk of heart disease by 20 to 25%, and much worse, it can increase your risk of stroke by 60%. Let me repeat it again. Uncontrolled hypertension, like stage 2 or beyond, if it is not controlled with medications, the risk of stroke goes up by 60%. So now you know why you need to control your blood pressure. Not only do you need to control your blood pressure for your own sake, but you need to do that for the sake of your family and children. I mean, just look at this family picture here. What happens if you were to get one of the complications from uncontrolled blood pressure or ignoring the treatment for blood pressure? So in conclusion, I would say you need to do this for the sake of your family and children. Thank you so much for watching this presentation on hypertension. What is a normal blood pressure? When you need to be concerned about it? What do you need to do about lifestyle changes? What time do you need medications, and why you need medications to bring your blood pressure down, even though you may absolutely have no symptoms. Thank you so much for watching this presentation, and please do watch a series of educational videos we have on heart health, and I will see you in the next presentation.